go on to the spine ultrasound at this point, and this is something that, of course, many of you may have an interest in, and certainly is something that I've been doing for a number of years. And we successfully treated a number of patients when I was at KTP. These are some of the papers, some of the very early papers, I think, in spine ultrasound. Alex and Hans were pioneers in some way, writing about it. And certainly, if you're interested in spine ultrasound, I would go and read these papers. They're very, very comprehensive, and it gives you a good sort of guide on how to approach things. In this paper, they're talking about looking at the lumbar spine and facet joints and the spinous processes and so on. Oops. And they just have very nice diagrams on what you're looking for. So when you're looking at this level, you should see the facet joints, and then as you move further out, you'll see the transverse processes, and that's where you're aiming for the foramen in terms of injections. They compared ultrasound versus CT, and they found that it's very effective in terms of their outcomes. And they've also written about ultrasound in periradicular injections. When you're doing the C-spine, the important landmarks are identifying the thyroid. You move posteriorly, you find the C7, which has only a posterior process, and then from there you count upwards. So the C6 and above have an anterior and posterior process. At the back, you can access the facet joints, and from a more slightly not anterior approach, you just move to the lateral aspect, and then you can get to the nerve roots from there. Actually, they're very superficial and very straightforward injections to do, and if you're careful, you can avoid all the neurovascular structures at the front, and you can really make a difference to patients' lives in terms of their pain. In terms of the lumbar spine, again, it's important to identify the spinous process, identify the levels. You can move laterally to have a look at the facet joints. You can see the transverse processes, and you can actually even see some of the ligaments that are sitting in between. And for the joints, you again have a look at the spinous process, look at the level. The spinous process in the lumbar spine is very large, whereas in the SI joint, it's a very small spinous process. And then as you move laterally, you can turn into a short axis view, and then you can very easily get into that facet joint there. And again, actually, the sacroiliac joint was my starting point in my journey in terms of dealing with the spine and the lower back. And I first came across this with, I think it was Jenny Saunders, who years ago came to visit us and was talking about PRP, even back then, in the SI joint as a treatment for SI joint pain. And so I started off with SI joints. You can either do it higher up at the PSIS, but that's only part of the joint, or you can do at the more cartilaginous part lower down, and that actually kind of flows a little bit more easily into the SI joint as well. So using ultrasound, just to summarize, targets can be the SI joints. You can go for the nerve roots, the facet joints. In the lumbar spine, you can go for nerve roots, facet joints. You can even do medial branch blocks and ablations as well. So there's a whole bunch of stuff that you can do. And in thoracic spine as well, which I haven't included here, you can go for joints, you can go for articulations with the ribs, and you can go for all sorts of nerve blocks as well. So if any of you are at all interested, do let me know, and then I'm happy to share more.